Have you started losing your confidence because of the loss of hair in the crown, and your loved ones and friends are already pointing out that the bald patch is developing in the crown, and you have taken medical treatment for the same for some years now, and now you are considering a hair transplant for the crown? And if you are worried whether this is going to work for you or not, whether the results will be natural in a crown hair transplant or not, whether the doctor is saying that the chances of success in a crown hair transplant are not that much as for the front, which area you should transplant first, the front or the crown? What if it fails? What if you already have undergone a hair transplant for the crown and it failed in your case? If these are the kind of questions you are facing, thinking, and these things are creating stress for you in your daily life, then this video about the crown hair transplant is just made exactly right for you. Hello, I am Dr. Satya Saraswat, a gold medalist plastic and cosmetic surgeon, and in the field of hair transplant, active for more than 17 years now, and have done thousands of hair transplants and have treated thousands of patients of hair loss till now. We specialize in crown hair transplant, and our team has 2 American board certified members who are members of International Society of Hair Restoration Surgery. If you want to see such kind of content more and more, then kindly subscribe to our channel. In this video, we will discuss 5 very important facts about crown hair transplant. So coming to the point number 1, the anatomy of the crown hairs in normal. Even in a child, you will see that the crown hairs are arranged in a whirl fashion. They are coming out at an angle to each other when as compared to the hairs which are in the front. In the front, the hairs are running parallel to each other, so there is very less degree of separation or angle between the 2 hairs which are coming out in the front. Whereas in the crown, the hairs are coming out at an angle to each other. So when the hairs are emerging at an angle, the underlying skin is highly visible in the crown, even in a normal person. If you see somebody from the back, you will see that even in a child or an adult without a history of a hair loss, a lot of scalp visibility is normally seen. This is a very important point for you to know, that because of this peculiar arrangement or a peculiar anatomy of the hairs at the crown, the scalp visibility or the skin visibility is always higher than in the front. So this is a very important point. Do like this video if you like the content till now. The second point which you have to understand about the crown is that it expands in the radial direction, whereas in the front, the hairs you lose from the front towards the back. If you have a isolated crown, which means only you are losing the hairs in the crown, it will keep on expanding in the radial direction on all the sides, towards the side, towards the front, and towards the back also. It will keep on increasing. So if you get a hair transplant done in an unstable hair loss patient, what will happen if you go for a transplant in the middle zone and the hair loss is expanding after a few years? Then you can have a patch of hairs in between and a thin or thinning zone all around. This is known as donut effect or halo effect. If you do a hair transplant in an unstable hair loss pattern, then this problem is bound to happen. If you have such kind of hair loss, I would request you to put your queries in the comment section below. The third most important point to take under consideration in crown hair transplant is if you have a very high grade of baldness, and if you have already undergone a hair transplant to the front is always given preference over the crown by the hair transplant doctors, as this is the area of primary concern to address or cover in the first sitting of the hair transplant, as people are called bald if you have the front hair transplant, whereas the crown is given a slightly lesser priority. So if you have already undergone a hair transplant for the front, there is a very high chance or a probability that thicker hair grafts or follicular units and 2 or 3 or 4 hair follicular units may have been already used in the front hair transplant. And again, a very high possibility is that for the crown, the remaining follicular units in the donor site may be just consisting of thinner hairs, or 1 or 2 hair follicular units may be there. This can be found out easily by doing a trichoscopic assessment and finding out the coverage value of the remaining hairs in the donor site. If you are looking out for addressing your crown hairs by a transplant, you can call us at the numbers given below. Now, before moving over to the point number 4, let us discuss a very important point on how to find out a good doctor to address your crown hair problem by a hair transplant. There are three important points which you have to look in the team you are choosing for your hair transplant. First thing is to look out for the qualifications and credentials of the doctor who is going to perform the hair transplant for you. Second thing is to check out the safety precautions which that team or the clinic is taking during your hair transplant procedure. Third important thing is to find out whether the team or the doctor is doing a detailed consultation with you in person about your problem, and they are doing the specific analysis, trichoscopy, making a customized plan for you for your hair transplant. Do watch this video in the link given above to know 5 important mistakes you have to avoid before you plan out for your hair transplant. Now, coming to the point number 4, who are those patients who get the best results out of crown hair transplant? So the first set of people are who have an isolated crown. They have an isolated crown, which means that they do not have a hair loss from the back to the front, and they have a family history of having isolated hair loss only. Second thing is that they have a very good donor site apart from isolated hair loss, in terms that their terminal S to vellus ratio is good on trichoscopy. The average hair thickness is very high on a trichoscopy, and if you are committed to taking the medical treatment after a hair transplant to prevent further expansion of your crown hair loss, and during the procedure your doctor has maintained the angle and the direction of your slits in a proper direction. As we have discussed that the angle and direction in the crown are different from that in the front, and if you make the same kind of directions as in the front, your hairs are going to look unnatural. And the last very important point in those patients who get the best results out of crown hair transplant is to follow the instructions given by your doctor or your team specifically and detailed. If you do not follow the instructions which are given, and they may be slightly different from the front hair transplant, the results can sometimes be jeopardized or they can be on the poorer side. Coming to the last point about the crown hair transplant, what to do if you have already had a failed crown hair transplant. So this has to be approached on a customized basis from person to person. The first thing which needs to be done is for your doctor to see the old operative records, how many hairs have been taken out, which procedure was done for you in the first sitting, what is the status of your donor site, and if your donor site is depleted as per a trichoscopy or an assessment or analysis, then you may need to look out for other sources such as body hair transplant or beard. And if the donor site is good but the density is on the lower side, you may opt for FUT procedure apart from FUE in only. So you need to assess your donor site. You need to see, is medical treatment working for you or not? Are you taking medical treatment after the transplant or not? If you have not taken a medical treatment, then you should talk to your doctor to see, is medical treatment going to be suitable for you? But in case if you have taken medical treatment, you have exhausted your sources of hair transplant, then there is something known as scalp micropigmentation, which may be useful for in your case. Do subscribe to our channel and share this video with your friends or colleagues or known people who are looking out for crown hair transplant. Do watch the video on your left if you want to see our results of crown hair transplant.